Welcome to week 8, module 8. I'm going to share my screen. All right, so this is going to be a synthesis of Claywell, chapter 17. These are going to be the learning outcomes that we're going to be covering. So this week on chapter 17, we're going to be talking about reflecting on your transition as an RN, registered nurse. So reflective critical thinking is an effective method for you to develop professional and personal philosophies. It's a dynamic process of analysis that forces you to examine any biases that you might have, beliefs, feelings, thoughts, and experiences in light of new nursing knowledge that you've gained over the last 7 weeks. It also gives you the ability to recognize problems from presenting signs and symptoms, awarenesses of the urgency of a situation and acting appropriately to the level of urgency, the capacity to design a plan of care that safely meets the needs of your client, understanding the nature of the plan of care in relation to your client's medical and nursing problems. You need to develop strong interpersonal and clinical skills as well. You need to capitalize on your strengths and challenges with a plan of action, but you need to prioritize what are the most important challenges that you need to work on. So establish short and long-term goals. Establish yourself as a capable, competent, and safe registered nurse. Act to the advance of practice, the nursing practice, through your actions and your skills. These assist you in establishing discipline and dedication to your professional development. Set aside study time. Request patient assignments that will help you learn. Ask your mentor or preceptor questions. Work through patient care scenarios. Consider what your previous LPN license duties would have been, and then envision how your role expands or changes within the scenario as a registered nurse. You may want to transfer to another unit or job because you've had a different role as an LPN previously. You need to examine your knowledge, skills, and any barriers that will keep you from moving fully into the role of the registered nurse. It can change or provoke anxiety. Make sure you develop confidence that will come with some of the different levels of experience. So even though you have experience as an LPN, your role as an RN will be different. To evaluate the effectiveness of your efforts to become an RN, take an emotional inventory, confidence inventory as well. Use your different support systems that you have, evaluate your journey through the transition from an LPN to a registered nurse. And the next one, we have a question that you have to answer on your transition. And then here are the learning outcomes that you'll be familiar with. All right, thank you so much.